Well, we're excited to have you joining us as uh, Colette is the chief medical officer and founder of Pausitive Health. And like I did with Dawn, I'm going to hand it over to you, Colette, to share a little bio on yourself because you can talk about it way more, in a better way than I can. So go ahead and just share a little background on yourself, and then we'll jump into some of the questions.
Okay, sounds good. I'm going to go pretty quickly. I am a gastroenterologist with an MBA from Wharton, and I also have additional training with a graduate certificate in health and wellness coaching, as well as training in translational health disparities at the NIH. And prior to my current work as founder of Pausitive Health, I was the National Medical Executive for Health and Wellbeing for Humana's 75,000 employee and dependent population. And I just wanted to say off the top and to echo what you had said and tie into the title of the symposium that I very much see digital as a tool and not an end in and of itself. Because at the end of the day, to your point, it's all about real people with real problems. And I learned very early in my career, starting off in practice and then across many roles with several organizations, that regardless of the role that I was in, that if you really focus on the person, and that person might be, in a different category depending upon the organization, but if you really focus on the person, that was key to everything. And it really brings a tremendous degree of clarity to decision making. And while I feel that healthcare has a lot to learn from other industries, healthcare is different. And you've got people's lives on the line, and the human body doesn't act timelines and ROI timelines, et cetera. So if for no other reason, in and of itself, it makes it very different right off the bat. And therefore, that has got implications for every stakeholder within the industry.
100%. And I think that is really at the core of where we need to be going with healthcare. And I love that perspective. Kind of picking up with that, we're going to talk a little bit about, women's health in this session and how we can innovate the healthcare ecosystem to support the menopause journey. And when we think about people and the fact that, nobody wants to be seen as a statistic or a population or even a patient. But we need to really make sure we have that human approach to everything that we do. But when I think about healthcare in the United States and even globally, women, if we talk about the US, women make up half of the US population. But when we think about research for healthcare clinical trials, there's really been a lack of data on women by virtue of how clinical trials have been conducted in the past, for a long time. And so as a result, there are gaps when it comes to really understanding conditions that impact women, whether it is, anything from cardiovascular disease cardiometabolic diseases, things like that, but also women's health in particular, as they're going through midlife, things like that, and menopause. Can you talk a little bit about how things like digital health solutions and the innovations that we're seeing in that space can support this gap that we've had, that not just women, but also women who might have been underrepresented based on race and gender and things like that?
So I think digital has the opportunity to be built from scratch, focused on people with a continuous feedback loop. And it can, particularly in an era of AI, which has a long way to go and needs to be properly leveraged, can bring tremendous power and understanding to the situation in terms of program development, in terms of the end user, whomever that might be. And separate from the digital divide, it also makes things more accessible to more people immediately and takes out some of the cost that would otherwise make some things not achievable. although there always have to be people in the process, just like there are people at the end of the rainbow of everything that we're doing in healthcare.
Yeah, agree. And when we think about the topic that we have here, looking at menopause, how do digital health solutions for menopause management contribute to reducing healthcare costs in the long term?
So I would say that one of the ways right off the bat is the hormonal changes that occur as a result of the menopause journey immediately increase the risk of a lot of chronic conditions. So heart disease, hypertension, stroke, metabolic syndrome, high cholesterol, depressive symptoms, anxiety, diabetes. Or if you already have those as pre-existing conditions, it may make things more difficult to manage. And all of a sudden, things have been going along well, and now they aren't anymore. And it's not really clear why that is. And so you can see that scenario happening where someone may have depressive symptoms, they're put on antidepressant medication, but really the issue is the falling estrogen levels, and what they really need for their symptoms is to get hormone therapy if that's something that they can take without any contraindications. So that would just be one example of taking cost out of the system. And then you can also see a scenario where if a woman doesn't have typical symptoms that people think of, like hot flashes or night sweats, they come up with palpitations as an example. And the next thing you know, they're going down the cardiology pathway, which may be completely appropriate, but because the menopausal transition can impact the entire body, just like COVID, you can have a multitude of symptoms, many of which are very common. And so women can twirl in the system for a very long time, getting a lot of workups done that might not have been needed, which is generating costs to everyone in the system, not the least of whom is the woman herself. And that's not to say that it's always going to be menopause, because it's not. But if no one is thinking about it in the first place, then that's a lost opportunity to think through a potentially unifying diagnosis and get the right care to that person as soon as possible, because people are suffering quite unnecessarily when there are lots and lots of options out there to help them.
Yeah, it really, when we talk about, the gap that I mentioned at the top of this, there's so much opportunity to focus on better understanding this change in life and how it's impacting people's lives. And it really just hasn't been studied that much, but it's nice to see there does seem to be a much more focused investment in this technology innovation space in menopause to better understand what the implications are for the women in general, but also, like you'd mentioned, for heart health and weight management and things like that. So really an important area to better understand. And and I know that we, as a part of today's symposium, we're doing your book giveaway, navigating your healthcare journey lessons about the U.S. healthcare system and real stories. Just as a sort of a highlight of your book, are there any sort of practical aspects or advice that you want to, like, sort of nuggets that you'd like to share here, just to sort of highlight the book and some of the insights that you've captured in the document, in the book?
So I would say that one of the biggest lessons and piece of advice is for people to recognize that they have much more power than they believe they have, and then it feels like they have. That I would wish that as people interface with the healthcare system, that they would become like the many parents that you see who have a sick child with cancer or a child with a rare condition. And often they get to know as much about the condition as the care team, and all their fear and not wanting to ask questions or not wanting to look stupid, all of that goes out the window because there's no time for that. They've got to know what's going on to do the best thing for their child, but yet they won't necessarily do that for themselves. And you, with the healthcare system, the way that it is, as complicated, as complex, as many different pieces and parts there are that are not tied together, I think that people definitely need to have a sense of self-advocacy going into the situation, knowing as much as they can before they go into the situation, when they are in an interaction, making sure that they understand, because if they don't understand and they leave, the person who's going to be impacted the most is going to be themselves, because no one's ever going to be in your body. No one's ever going to know really what you're thinking except for you. And no one's going to care as much, other than probably a parent for a child, as you about your own health and well-being. And that, certainly ties into the case of women on the menopause journey who not infrequently are told that it's stress, or it's hormonal. But while they're saying hormonal, they aren't even really thinking menopausal hormonal. They're thinking something else. And when you look at, close to 18% of the workforce in the typical age band for menopause, that's huge. And when you look at a system where 69% of GYN residency programs don't have a designated menopause curriculum, you can see how it is a perfect storm for a less than optimal experience, as well as delayed diagnosis, misdiagnosis, and a lot of suffering, as I said, that is really quite unnecessary because there are lots and lots of options. And if you are a woman of color, if you are a member of the LGBTQ plus community, then that is just an additional layer of health disparity and inequity that is added to the picture.
Yeah. Well, I think self-advocacy is great advice for anybody. And for women in particular, I think women drive 80% of the medical decisions for their households. So we need women to be healthy and in good shape so that they can continue to live good, healthy lives and have their families thrive. So with that, Colette, thank you so much. I have a bunch of other questions I'd love to ask you as well, but we're out of time. But thank you so much. And definitely everybody register for the book because it's sure to be really insightful. Thank you so much.
Thank you.